My name is Clint Bahler. I'm a urologist at Indiana University, and I get to specialize in prostate cancer. So almost my whole practice is in prostate cancer, and that allows me to do the diagnosis, biopsy through treatments like focal therapies, HIFU, but then also robotic surgery as well. So I'm very fortunate, being from the birthplace of focal therapy, the birthplace of Sonoblate and HIFU. I got to observe very early on and work with researchers from Sonoblate, and so it was a very natural choice for me to use the technology. And I think the biggest reason is to have an option for men that's less aggressive, because we want to try and match the treatment to the cancer. We don't want to overtreat the cancer. Yeah, in terms of outcomes after prostate cancer treatment, initially, we're all fixed and focused on the cancer and on getting it cured. But of course, once we have that dealt with, quality of life becomes so important. And so urine control, sexual function, in addition to cancer control, is important for the patient. Also, time off work and time down, recovery, and all those things are important for the patient as well. Yeah, so I finished my training in 2015 and then started using Sonoblate HIFU around 2016 or 17, so close to 10 years now. And during that time, Sonoblate actually got FDA clearance or approval for ablation of prostate tissue. So we started doing the focal or MRI-guided HIFUs around 2016 or 17. So now I've done more than 200, and probably this year hit around 250 HIFU cases for prostate cancer. Yeah, the challenge today and in medicine is there's so many data points that come into play. So there's the PSA and the biopsy and the imaging and genomic testing, and it's overwhelming, I think, for everybody. But one of the most important things to realize for prostate cancer is it's very slow moving. So you want to take your time, understand the treatment options, and even I would tell patients, if you need or want to get a second opinion, that's important, because before you jump to treatment, you want to have a peace of mind so you can go into that treatment confident and get through the healing process. So the good news is prostate cancer is slow. That gives us time to plan the treatment so that we try and make sure we're not over-treating, we're not under-treating, but we're doing the right treatment for each patient. Yeah, I think prostate cancer screening is important, because the earlier you catch cancer, the simpler the treatment, the less aggressive the treatment. And I've often been surprised at how many men that come to my office have been married for 40, 50, 60 years, and then I realize their spouses care about them, and their spouses want them to be around for a long time. And so I think with Prostate Cancer Awareness Month, it's important to get screened and just realize that earlier the cancer's caught, the less aggressive the treatment has to be. The advice for middle-aged men is, health is the first wealth, right? If we're not healthy, nothing else matters. So take care of yourself, and that's physically, diet, nutrition wise. And I talk to all my men in their 50s and 60s that have prostate cancer. I talk to them about the diet, nutrition recommendations that could help them to decrease the aggressiveness, help their body fight the cancer. And it's not surprising. It's a heart-healthy diet. It's a low-carb diet, low-sugar diet. And so focusing on things to keep yourself healthy, and then the physical activity. And then, realize there's a lot of treatment options for prostate cancer. And again, the earlier you diagnose it, the better, the less aggressive the treatment has to be.